Get close to him. It's not all that contagious like that.
February 10 is a day set aside to mark International Day Against Epilepsy, a day to create awareness on the need to address the conditions associated with the disease, especially with those who are impaired with it. In an exclusive interview with BTV News, a general health practitioner, Dr. Ogene Rukewe, said epilepsy is a seizure disorder of involuntary movement of the part of the body and spiking of electrical signal, as this could affect children, elderly ones too.
Epilepsy is a seizure disorder and it is characterized by involuntary movements of a part of the body or the whole part of the body, and it occurs as a result of spiking of electrical signals in the brain. And ways that it can be prevented: first of all, general health promotion, and this involves you educating people, educating first of all an individual, then the community, where the government can come in and educate people about epilepsy. Then it now involves the health sector, and it should be people that are epileptic. It's advisable for them to avoid swimming, going to swimming pools and getting involved in swimming, and also driving alone.
Other respondents who spoke with BTV News called on the government, especially health agencies, to take more proactive measures such as early diagnosis and treatment of people who are affected. Meanwhile, they called for awareness on the disease, adding that with constant awareness, it will help people who have it look out for themselves.
The government is not addressing the issue well. Most of them have been neglected. I have a patient of such before, a relation, and I know the way I manage it. Until I traveled, I left her in the village and came. But when I left her in the village, there was nobody who was handling that, and she died early. So the government should come to the rescue of this epilepsy patient. That is the way I just want to treat it.
Epilepsy is a disease that, if known, can be managed. It do occur in different occasions. It's hereditary. They can inherit from the family. And they can, other way, they can use it to maybe to tarnish that person's image. So, but when somebody discover it, can be managed by taking medicated drugs being prescribed by the physician. Then when you take your medicated drug regularly, it can be managed.
But from the little I know about epilepsy, is a kind of unconsciousness. Somebody that was stable, they become unconscious. You understand? Like at times you see people running away from them. You understand? I know that it is not all that contagious like that. You can touch an epilepsy patient, you can, get close to him. It's not all that contagious like that.
Apart from early detections, constant awareness on controlling the epilepsy disease is vital. Freeman Usawi reporting for BTV News.